When Professor Muhammad Nasir Sambo assumed office in July 2019 as Executive Secretary then, but now Director General NHIA, he was handed a list of 10 presidential mandates for immediate implementation, part of which included stability of the scheme, addressing all lingering HR issues including promotions and pensions, etc. So far, the journey has been like that of roses with its thorns, with the goal of advancing health insurance in Nigeria topmost on the agenda while increasing the efficiency of the NHIA. The program tonight brings you a review of achievement of the Professor Nasir Mohammed Sambo's administration so far and how it has fared. My name is Aisha Muhammad Ahmed, your regular anchor, welcoming you to the program Easy Access to Healthcare for All, sponsored by the National Health Insurance Authority. Join me after the break for more on this. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
We begin the program with the news about the NHIA, its state offices, as well as other stakeholders in the health insurance sector. Let's see what we have.
My name is James.
The new Managing Director, Nigeria Communications Satellite NACOMSAT, Engineer Muhammad Lawal, on Monday 24th January 2023, paid an oversight visit to the National Health Insurance Authority. The MD, in company of members of his management team, was received by the Director General and top management staff at the NHIA corporate headquarters. Speaking at the event, Engineer Tukuru appreciated the authority for its partnership, saying he was overwhelmed with the progress achieved by the NHIA. He pledged maximum support towards the implementation of the ENHIA project.
We came here, sir, to thank you, and to thank you, and to thank you. When everybody had doubts in NACOMSAT, people are not sure they can do business with us, people are not sure we can deliver, you trusted us, you are the facilitator. You gave us opportunity to showcase that we can deliver our capacity. We remain thankful. The history of NACOMSAT will never forget NHIA. We have done a lot to us to give us the confidence that yes, we can do it. And we believe we can build on this to do even better things. As I said, this is a short visit to say thank you, thank you, thank you, thank you. Our relationship has been very productive. Looking at the amount of money we save the country, which is very important at this material time. Also looking at the fact that we save some foreign exchange when the security, when the data is still in South Africa, is still here. NHIA, I believe, needs accurate, adequate, on-time and secure information. And we are very important stakeholders to make sure this happens.
Responding, Director General of the NHIA, Professor Nasir Mohammed Sambo, appreciated the team for the visit. He also applauded them for their tenacity and diligence since the commencement of the project, while urging them to fast-track the full implementation of the ENHIA as it holds numerous advantages.
We were able to save the country a cost of more than 6 billion naira.
9 billion.
It was 6 to 9 billion naira. Because the 3 billion has to do with the expansion, which we have integrated. But if we are looking at it at the initial costing, without expansion, we are talking about 6 billion naira. So because of the expansion, when we were doing NHIA, we expanded the scope beyond what was approved in the past. So all in all, you can say that about 9 billion naira is saved from the project. Through this project, we were able to develop a lot of capacity of our staff and even the NACOM staff, NACOM staff. Before I conclude this, I want to specifically appreciate the NACOM staff who have worked assiduously on this project. its particular mention is the former MD. She had cause to be coming to this organization on several occasions, and even where we had some hitches in BPP.
NHIA is a critical partner to NHIA in the development of automation of its business processes known as ENHIA. The National Health Insurance Authority has paid a visit to the Federal Ministry of Mines and Steel Development for sensitization exercise. The sensitization team was led by Franklin Julius, Assistant General Manager, Media and Public Relations of the NHIA. He enlightened the audience on the new NHIA Act and why the old Act was repealed. Mr. Julius also went through rights and privileges of enrollees, as well as the NHIA benefit packages.
I will take you through that program, but first of all, let me go through your rights as an enrollee of NHIA. When you are coming in freshly, you have the right to select your hospital. You have the right to select your hospital. Nobody chooses hospital for anybody. We encourage people to choose hospital that is closest to where they live so that you can easily access it. When you enroll, you have the right to what we define as benefit package. There is a benefit package attached to all enrollees. By benefit package is all those services you are entitled to that you are not supposed to pay for. Services that federal government has already paid for. So you are entitled to those benefit package. And it runs from primary services, secondary services, and tertiary services.
Speaking further, the AGM used the medium to educate them on the NHIA flagship program known as Gift Ship, which is bringing those in the informal sector into the health insurance.
The program is designed for those who are in the informal sector fold to cover them. Now, that program is 45,000 naira renewable every year. That 45,000 naira is for one person, and it can still accommodate 2 more additional persons. Still for 5,000 naira. One person for 5,000 naira. 3 persons for 5,000 naira. So a group of related siblings can come together as 3 of them and pay for 5,000 naira, and they will be entitled to those benefit package I have talked about, primary, secondary, and tertiary. As a matter of fact, we encourage people to assist others. If God has blessed you, you can just go to your community and then put 1 or 2, 3 people together and pay for them.
At the end, there were questions, while answers were preferred by the NHIA team.
Welcome back. The program is easy access to healthcare for all. Since his appointment in July 2019, the Professor Nasir Mohammed Sambo's led administration has worked assiduously to change the narrative about health insurance in Nigeria. 3 years on, stakeholders in the health insurance sector will attest to the fact that healthcare for all is truly a more realistic target now because of the successes recorded within the period. In this episode, we'll take you through some of the successes recorded by the administration of Professor Nasir Mohammed Sambo since he was appointed into office in July 2019. Please stay tuned.
We have seen leadership come and go in the NHIS, now NHIA, before the emergence of Professor Nasir Mohammed Sambo. There were turnovers of leadership in the NHIA, which affected the stability of the authority.
So there are other challenges within the National Health Insurance Scheme, which has to do with instability and incessant turnover of the chief executive officers. When I came to the National Health Insurance Scheme in 2019, I was the 12th chief executive within 20 years. On average, you are talking about every 2 years, one chief executive will go down. because of the inherent instability within the National Health Insurance Scheme. But this number that I said, it includes those who came as executive secretary as on permanent appointment and on appointment by presidency, and those who have acted. So it's not all that substantive chief executive. So this is one of the major problems that militated against a stable NHIS.
Before the appointment of Professor Sambo in 2019, the authority was faced with various challenges such as poor human resources and administrative management, indiscipline, and division among staff and union members, among other problems which affected the performance of the organization. These challenges prompted President Muhammadu Buhari to set up an independent presidential panel to investigate the organization and make far-reaching recommendations, which brought in the present leadership of Professor Nasir Mohammed Sambo.
Mr. President had to intervene in the year 2019 by setting up independent presidential panel that investigated the organization, and they made a far-reaching recommendation. And part of the recommendation was why I brought into the National Health Insurance Scheme to try my best and to see how the organization can be stabilized and put in a very good pedestal for attainment of universal health coverage.
Professor Nasir Mohammed Sambo and his team resumed office with a presidential mandate given to him by President Muhammadu Buhari. To set the ball rolling, Professor Sambo adopted a three-point agenda that has continued to guide his management of NHIA. Restore value system within the NHIA in order to make it a credible and result-oriented organization, engender transparency and accountability in the entire operations of NHIA, accelerate the drive towards attainment of access to quality healthcare in line with the President's agenda and sustainable development goals. One of the successes of Professor Sambo-led administration was the 10-year strategic plan that will serve as a pathway for the authority to achieve its targets.
It is a well-established fact that failure to plan is a plan for failure. To this end, the scheme has developed a 10-year strategic plan, 2020 to 2030, which serves as a roadmap for achieving its mandate. The implementation of plans has commenced in earnest. With this all-important document, efforts toward attainment of universal health coverage in Nigeria is now well focused, and the milestone can easily and accurately be tracked.
Another major success is the creation of an innovative program called GiftShip that will help Nigeria in attaining universal health coverage by bringing everyone on board the health insurance train.
GiftShip is designed to bring the informal sector groups into health insurance ecosystem. In line with this, individuals, families, groups, associations, philanthropists, as well as Nigerians in diaspora can have opportunity to contribute and benefit from the program.
Another major area of success recorded by the NHIA is in the administration of drugs. The Professor Sambo-led administration started a medicine supply initiative that will meet the needs of enrollees when they visit the hospitals.
This initiative is designed to address the lingering problem of out of stock, as well as incessant complaints of substandard drugs by the enrollees. Under this arrangement, drug manufacturers will manufacture NHI's branded drugs at a cheaper rate, therefore addressing the issues of availability, accessibility, affordability, and quality drugs for our team enrollees.
One fundamental task that was part of the presidential mandate given to Professor Sambo was capacity building for staff of the authority. He speaks on the successes attained in that area.
In the areas of capacity building, NHIS has trained over 425 staff in ICT through our collaboration with digital-based institutes. NHIS has also trained a total number of 927 staff across its headquarters, zonal offices, state offices in the new business process that has been developed. Recently, the scheme unveiled the NHIS Leadership Program, NLDP, which is being implemented with the support of development partners, R4D, and all the general managers in the scheme have been trained, and the training will soon be extended to NHIS state coordinators and chief executive officers of the state health insurance agencies.
Other achievements of Professor Sambo's administration include the new NHIA Act that makes health insurance mandatory, the adoption of the health insurance under one roof model, and the decentralization of its business processes to the states. No doubt, the last 3 years of Professor Sambo's administration has really established and put the NHIA on a trajectory towards achieving its mandate.
Welcome back from that break. Easy access to healthcare continues in our stakeholders segment. Today in this segment, we'll bring you an interview with Dr. Adamu Onu, Medical Director at Garki Hospital, Abuja. Garki Hospital runs a public-private partnership policy with 2/3 of its patients being under health insurance. He begins with issues affecting access to healthcare in Nigeria.
The problems of accessing healthcare in Nigeria has to do with inadequacy of resources and also financing as well. First of all, Nigeria itself doesn't have enough doctors, nurses, or healthcare professionals. When you look at the country as a whole, you find that most of these skilled manpower I've mentioned are concentrated in the major urban areas. And so that leaves people who are not living in the urban areas with very little access to skilled healthcare personnel. In addition to that, we also have the issue of financing. A lot of Nigerians cannot afford healthcare, and that's the truth of it. I mean, for just little sum of money, a lot of people cannot afford. And some of us who have worked in rural areas have lots of stories that we can tell regarding how that lack of financial resources imposes a barrier to accessing healthcare. So those are, for me, the two major issues related to access to healthcare in Nigeria.
Dr. Onu says the introduction of NHIA is a good move that has made healthcare available to Nigerians.
And so it's very difficult anywhere in the world for people to be able to pay out of pocket for healthcare. In fact, it's been known that sudden medical emergency can actually impoverish a family, because with the little resources that people have that they are managing for their day-to-day living, and then a medical emergency comes up, and then those resources are now diverted into trying to get treatment, it can actually cause a family to drop into poverty, because you have instances where people might now have to sell cars, property, houses, just because they are trying to raise money for treatment. And we often have a lot of people who are unable to afford their medical bills. That's a huge problem in this part of the world. And so the introduction of health insurance is a means to be able to take care of that problem, because people who have health insurance often do not have to battle with this issue that I'm talking about. For the most part, their health insurance is able to address most of their health.
Garki Hospital is one of the facilities that has really gained the admiration of the leadership of the NHIA as well as development partners because of its operations. Dr. Onu gives a brief on the structure put in place.
The hospital, the way it's organized, we have a managed care department or unit which is staffed by people that we have trained specially in how managed care, how insurance operates. And we have in place in the hospital SOPs and documentation, which we use to manage the process. So at any given point in time, the staff here know what to do in relation to insurance patients, NHIS patients. So whether it's primary care, whether it's secondary care, fee for service, they already know what to do because we have guidelines in place, we have SOPs in place. In fact, what we did was we basically took the operational guidelines of NHIS and we internalized it. We basically operationalized it within the hospital and made it part of our process. So it's integrated into our electronic medical record system. It's part of the SOP of our staff from the front desk right into the back office of the managed care, and even extends all the way to claims processing and sending out of bills to the HMOs. So basically, I would say this hospital, the way we've set up, we've basically built our operations around NHIS.
At the end, he speaks on working relationship with the health maintenance organizations.
It's a mixed bag. We have HMOs who are doing very well, and we also have HMOs who are not performing so well. Capitation has not been an issue. At least all the HMOs pay capitation promptly and regularly. Where we've had challenges with some of the HMOs is in the area of fee for service. We send out claims to them, and some of them are not very efficient in how they process their claims. And oftentimes, after we've sent claims to them, some of them would not pay us the full amount that is due to us. And so this is an issue and an area where we've been engaging with the HMOs. And the NHIS itself has also been very, very helpful because they've also intervened on several occasions and helped us to be able to get our due from the HMOs. So like I said, it's been a mixed bag. We have the HMOs who are doing very well, and we also have a few of them who are doing poorly. But again, like I said, this is something that the NHI is already looking into and addressing. So we're really grateful for that.
That was Dr. Adamu Onu, Medical Director, Garki Hospital, Abuja, speaking on the operations of the NHIA. Up next on the program is your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: where can one register for the NHIS?
We have the NHIS state offices. One can go there and register with the NHIS for the various programs. We equally have what we call the contact center in Abuja, where anybody can go in and do enrollment.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
With this, we've come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and same station for another interesting package. Do enjoy your evening.